Right. So for the next, it's more of like an you could say an imaging modality. All right, but this one is mainly to diagnose, to check out for the density of bone, So I want to check out for the density of bone. This is because I want to check out for my calcium levels. I want to see, maybe why a patient actually had a fracture, so all of that, everything related to bone. All right, I just want to see how strong somebody's bone is. So that's what is known as a dual energy X-ray absorptiometry, right? You can abbreviate it as what? DXA or DEXA, anyone, right? So it's also known as what? DEXA. A specialized imaging technique is used to measure bone mineral density. You want to see how thick somebody's bone is. Do you understand? So you want to assess the body composition. So it's a gold standard for diagnosing any condition that have to do with bone fracture, especially osteoporosis. You can also have osteopenia, you can also have all those rickets, osteomalacia. There are so many, but mostly osteoporosis. Okay, so how does it work? We said that two X-ray beams at different energy levels, all right, measures how much of each beam is absorbed by your bone or soft tissues. So this can calculate bone density by subtracting what? Bone tissue absorption. Right? So they can measure it based on T-score, Z-score. Okay, I think the T-score, they are trying to compare you with people that are in your age group, while the Z-score, they are trying to compare you to, a teenager or a younger person, of your sex, and all of that. So this is a measurement, right? So T-score is a healthy young adult. T-score is the one that is healthy young adults. Z-score is your age peers, and all of that, So clinical uses can use to diagnose what? Any condition that has to do with weak bones, like osteoporosis, osteopenia. Can monitor bone loss over time. Can evaluate fracture risk, assess body composition, right? Track response to treatment for bone-related conditions. Right.